My name's Karen Grant and I am the Director of Admissions for the medical degree programmes here at Lancaster University. We have two programmes available if you want to study medicine at Lancaster. One is the standard 5-year programme and the other one is a 6-year programme which includes an initial gateway year. We've prepared a couple of PowerPoint presentations for you to look at. One will cover the course content and the key features of our degree programmes. And the second covers our entry requirements and our selection process. Hello, my name's Karen Grant and I'm Director of Admissions for the medical degree programmes here at Lancaster University. In this presentation, I'm going to tell you a bit about both programmes that you can apply to study medicine. The first programme is our main medical degree programme, A100. It's a 5-year undergraduate programme. We have 125 places available for students from the UK and EU, and 4 places for international students. The key features of our main programme are that it's delivered through problem-based learning, we have early clinical experience, and at Lancaster Medical School we pride ourselves in providing a supportive environment to allow all our students to flourish. The second programme that's available is A104, which is Medicine and Surgery with a Gateway Year. It's a 6-year programme and we only have up to 15 places available on that programme. Only UK students are eligible for the A104 programme and there's specific eligibility criteria which I'll cover later on in this presentation. So as I said before, it has an initial gateway year and then it merges with A100 in year 1. If I start off with talking about what our medical students learn while they're here at Lancaster, you can kind of divide what they learn into 2 domains, the knowledge domains and the skills domains. If I cover knowledge domains first, this is the information that the students are learning through problem-based learning and through their clinical experience during their 5-year programme. And the knowledge can be split into 4 curriculum themes. If we start off with medical sciences first, this obviously constitutes a large proportion of what the students need to learn. It's about the biology of how the body works, how it goes wrong in disease, and how you might combat that with drugs, surgery, lifestyle interventions. It's a very important component of the medical degree curriculum, but it's not all that the students have to learn. If I then move on to the next curriculum theme, which is health, culture and society, this covers the things about your patient that might influence whether or not they're healthy, but are not directly related to the biomedical science that underpins a disease process, for instance. So an example of that might be what socioeconomic group your patient belongs to. Those in higher socioeconomic groups tend to have much better health than those in lower socioeconomic groups. But the reasons for that are complex and multifactorial, and it's important that future doctors understand those factors that influence their patient's health. Also within health, culture and society, you cover what we call psychology of health. It's about how your patient thinks about their health, how they make decisions about whether or not to consult the doctor and whether or not to take their doctor's advice. So again, very important for future doctors to understand that. So if we move on to the third curriculum theme, population health. Population health will cover a number of different topics within it. For instance, public health, and by that I mean interventions that are made to improve the population's health. And that might cover things like the immunisations that children get. It might cover health education messages that are such as eating 5 pieces of fruit and veg a day or taking regular exercise. Those are interventions that are used to try and improve the nation's health overall. Linked to public health is epidemiology, which is the study of the incidence and prevalence of disease. And those would be used to, epidemiological studies would be used to assess whether public health interventions had really improved the nation's health. Also within population health, students will look at different types of study design that are used to assess the effectiveness of brand new drugs, etc. And they'll cover medical statistics. Again, that's looking at how do we track the incidence and prevalence of disease. They'll also cover medical statistics. The final curriculum theme is professional practice, values and ethics. And again, this will cover a number of different subtopics. It'll get the students to explore the ethical complexities of medical practice and help them to make difficult decisions in the future about what's the best course of action to take. They'll also cover professional guidance that regulates how doctors are expected to behave. And finally, it will cover medical law, the kind of legal implications and requirements of medical practice. So those 4 curriculum themes cover the knowledge that students are expected to learn while they're at Lancaster Medical School. The majority of it will be delivered through problem-based learning, but the students are also learning about all of these topics while they're out on placement, interacting with patients and interacting with our clinical colleagues. If now I talk about the skills that students learn while they're at medical school, here I have split the skills into communication skills and clinical skills. I would argue that communication skills is actually a key clinical skill, in that a doctor has to be able to talk to their patient effectively and get them to trust them before they can help in any way. But communication skills is taught separately from the rest of clinical skills, and so I've kind of separated it out in this case. Clinical skills, in this case, I'm thinking about practical procedures and examinations that doctors need to be able to perform. So practical procedures might be, can they take blood? Can they give an injection? Examinations might be, can they examine the cranial nerves? Can they examine an abdomen? Those kind of clinical skills. So over the course, so again, communication skills and clinical skills are learnt in a classroom environment to start with, but then are really properly learned when the students are out on placement and interacting with patients. And I'm going to tell you a little bit more about how we deliver what the students learn over the course of 5 years. As I said before, our curriculum is delivered through problem-based learning. Problem-based learning is a form of small group teaching where the students are really encouraged to learn through their own curiosity and develop skills that they will need to keep their knowledge up to date for the rest of their career. Problem-based learning doesn't happen in a vacuum. The learning that the students do through problem-based learning is supplemented with anatomy teaching, which I'll talk about a bit about later, and also with a small number of lectures. The lectures in our course are really designed to help signpost students to important topics that they must understand in depth, and to help students understand the level of detail and depth that they need to understand particular topics. Next, I'm going to tell you a little bit more about how problem-based learning works. So in first and second year, the students are given a written scenario which is based on a realistic clinical situation. It will tell you a bit about the patient, their signs and symptoms, why they've decided to consult with a doctor in this particular incidence. It might tell you a bit about the disease condition that they suffer from. In fact, everything that was in those curriculum themes that I talked about earlier, there'll be elements of the scenario which will deal with all 4 of those curriculum themes. The students read the scenario and discuss what they already understand. And in every single case, they will already understand something in that scenario based on what they've learnt at school or previously in their medical education, or based on their past life or voluntary or work experience. So the students read the scenario, they discuss what they already understand, they discuss what they don't understand, and they discuss what they think they need to learn in further detail as a medical student at the particular stage of their training. And in doing that, they set their own learning objectives. This is facilitated by their tutor, who makes sure that they don't miss anything important and that they're setting appropriate learning objectives. The students then go off and engage in independent self-study. So most of the time this is reading textbooks, but the students also are able to use a variety of different resources to help them learn material relevant to their learning objectives. For each module, the department makes available a list of recommended resources, which, as I said, will mostly be textbooks, but it might be scientific articles, it might be websites that are appropriate, or it might be little video clips. All sorts of resources are made available to students to give them a good indication as to what we expect them to learn in relation to their learning objectives in this module. The students then come back and discuss what they've learned with the rest of their PBL group. And this part of the process has got 3 different purposes. Students are often worried that in problem-based learning they don't know exactly what it is that we expect them to learn. So this part of the process is how we give them some feedback as to whether or not they've learned the right material. So the first purpose is that they're checking against their peers that they've kind of learned the same material as everyone else. And if they're sitting around a table discussing with their peers and recognise all the topics that are being raised, then they've probably learnt the right material. If they're sitting at the table and their peers are all talking about something that they haven't learnt at all or don't recognise, then that might indicate that they've missed something during their independent study, and it gives them an opportunity to go back and rectify that. The second purpose is that the tutor is checking that the students have learnt the right material, and especially in first and second year, it's making sure that they've learnt the material to the correct detail and depth. The tutor will be listening carefully to what the students are saying and will ask questions, especially if they identify that the students maybe don't understand something or have not learnt the right amount of detail for a particular topic. The difference from school and university is that the tutor may well ask questions, but they won't be telling the students the answer. They expect the students to reflect on why they can't answer a particular question and remedy that in their own time. So it could be that they can't answer the question because they maybe used the wrong resource to address a particular learning objective, so they've not gone into the appropriate detail. It might be that they do have information in their notes that would allow them to answer that, but they can't remember it at that point of time, and that's absolutely fine. They just need to go back over their notes. Or it might be they got to that bit in the textbook and decided it was a bit too complicated and skipped over it, in which case the harsh reality is they need to go back and revisit the detail that they actually do need to know. And the third purpose of this part of the process is just to help the students manage their learning. At medical school, students don't really have to learn anything that's particularly difficult, but they do have to learn a lot of material. In problem-based learning, the students have to learn the material as they go along because they need to be able to come to those PBL sessions and discuss what they've learned without their notes. So simply by kind of encouraging students to learn the material as they go along, revisiting topics both within the year and in subsequent years, it helps the students to learn that material in a way that they'll be able to retrieve it and recall it in practice. So after discussing what they've learned with their peers, students should be applying what they've learned to the scenario and asking, do I now understand everything in that scenario? In first and second year, when the students are becoming familiar with problem-based learning as a way to learn, they have the opportunity to go back round that cycle, to read and discuss a bit further, set additional learning objectives, engage in more self-directed study, and come back and discuss additional material. When they get into third and fourth year, students will use a mixture of different stimulus for their learning. So they might use some written scenarios, they might use real patient histories as a way of addressing their learning, but they will still be using this process to learn the material that they are expected to learn. Problem-based learning works well for those who enjoy discussing information with their peers, who like working in small groups, who find that discussing information helps them to learn. It's a good way of developing students' problem-solving skills. The kind of skills you need to read a scenario, work out what it tells you and work out what it doesn't tell you are very similar to the skills that you need when you take a patient history and use that information to diagnose what's wrong with your patient. It also helps the students to develop their team working skills. They're working in small groups of 7 or 8 students, all trying to achieve the same aims. So it helps them to be able to develop those skills. It also allows them to develop study skills that will help them to keep their knowledge up to date for the rest of their career, because they're learning how to recognise when they don't know something, find information that's relevant, and appraise when they've learnt enough to fully understand a particular situation. So that's a bit about problem-based learning. Next, I'm going to talk briefly about how anatomy is taught at Lancaster. We don't do cadaveric dissection at Lancaster, and the students use a variety of different ways to learn about anatomy. The teaching is very clinically focused. It's not about just memorising the blood vessels, the muscles, etc. It's about trying to teach the students why they need to understand the anatomy in the context of of their future clinical practice. We have lots of different ways in which the students can learn about anatomy, and that allows the students to pick and choose different ways that work best for them. We have a variety of detailed anatomical models. We have a number of digital technologies that are used to help the students learn anatomy. There's a big focus on learning anatomy in the context of medical imaging. And so that's looking at the different modalities of medical imaging, what kind of tissues each modality is used for, x-rays, ultrasounds, etc. And how can you tell from that image what anatomy you're looking at, whether it's normal or whether there's any problems. One of the digital technologies that we use is something called an anatomage table. The anatomage table is like a giant iPad that has all the information associated with a human body in there. And it allows you to look at the anatomy at various different levels, from gross anatomy zooming right down into the tissue. It allows you to take slices through that body at different angles. It allows you to see how different organs relate to each other within, for instance, the abdominal cavity. It allows you to rotate the body. It allows you to do all sorts of fancy things to help the students build up their knowledge of anatomy in a kind of 3D sense. The students also have available to them an ultrasound machine that's within the anatomy teaching suite, which they can use to explore specific ultrasound models, and it helps them to develop again a sense of 3D anatomy using that particular medical imaging. I said before, we don't have any cadaveric dissection at Lancaster, and that means that the anatomy learning suite is available to the students 24 hours a day, 7 days a week. And the students are able to come in and use that facility to help develop their knowledge and understanding of anatomy, and they do on a regular basis. Here I've shown you a web link to a little video clip that tells you a bit more about how anatomy is taught at Lancaster, and that might be useful for you if you want to be reassured how the students are learning. I said at the outset, one of the skills that students have to learn is clinical skills, the practical procedures and examinations that doctors need to be able to perform when they're practicing. A lot of the clinical skills teaching is front-loaded into first year. The students have a weekly teaching session in a purpose-built lab. In those weekly sessions in year one, the students will learn all of the practical procedures and examinations that doctors need to know. They will start off learning on what we call part task trainers. In this photo you will see a plastic arm on which students are learning how to take blood, and only once a student is deemed competent on the part task trainer, the plastic arm, will they be allowed to practice that skill on a real patient. Students also practice on each other, and that's a really useful way to learn clinical skills, because you're learning by doing, but you're also learning by having the clinical skill, the examination, for example, done on you, about how hard you need to press to be able to feel what needs to be felt, and how uncomfortable that examination is if you're the patient. So I think that's a really useful way for students to learn. Clearly, once they have left first year and they're out on placement in years 2 to 5, the students are then learning clinical skills in the real life context. So in second year they have a small set of practical procedures and examinations that they're allowed to deliver with real patients, and then in third year they have a slightly different set of skills and practical procedures that they're allowed to perform on patients. Fourth year a few more, and then by the end of fifth year they should be competent in all the practical procedures and examinations that a foundation doctor needs to be competent in to practice safely. So that's how it's taught. The students have a clinical skills exam at the end of each year, and they have to be competent in not just the written exams, the knowledge part of the curriculum, but they also have to pass the clinical exam to be able to pass into the next year. Next, I'm going to talk about how students learn communication skills. It's done in small group teaching again, where the students learn about the principles of effective communication, and then have the chance to implement those techniques of effective communication in a safe environment, interacting with simulated patients, so that's actors who are pretending to be patients. And that allows students to practice their skills, make mistakes, perhaps stop and restart a consultation when things don't go to plan, and it just allows them to develop some strategies to make sure that when they first interact with patients on the wards or in GP practices, they are better able to talk effectively with their patients. In those small group interactions, when they're interacting with a simulated patient, these are often captured on video, and then the students have the ability to watch those videos, reflect on their own performance, and they'll also get constructive feedback from their tutor and from their peers during those sessions. Once the students go out onto place, they still have some communication skills training sessions, but they're maybe reflecting more on their real life experiences and trying to improve their communication skills through practice in that kind of classroom environment. So during the course of 5 years, the students will go to a number of different clinical placements. Some of those will be based in hospital, some of those will be based in GP practices. The main hospitals that we use for hospital placements are the Royal Lancaster Infirmary in Lancaster itself, Furness General Hospital in Barrow, Royal Blackburn Hospital in Blackburn, and the Blackpool Victoria Hospital in Blackpool. So there's 4 base hospitals that are used for the placements throughout years 2 to 5. In terms of community placements, so I said before that's mostly in GP surgeries, those are over a wide geographical area of North and East Lancashire and South Cumbria. And over the course of 5 years, students will go to a variety of GP practices and be able to see how primary care is delivered in a number of different settings. For example, they'll go to a mixture of urban and rural practices, and practices that are in affluent areas and practices that are in quite deprived areas. So again, that helps the students to appreciate how primary care needs to be delivered in different contexts. I said at the very beginning that the 6-year programme has an initial gateway year. The purpose of the 6-year A104 programme is to attract a wider range of students to study medicine and to increase the diversity in our future doctors. It's important that the medical profession reflects the breadth of society and also the patients that they will treat in the future. In the other presentations, we'll talk about the entry requirements that are required for the A100 and A104 programmes. The entry requirements are lower to get onto Gateway Year, but there are a number of additional eligibility criteria, and that will be dealt with in the other presentation about entry requirements. So students can come onto the Gateway Year with, for instance, lower A-level grades, and then we use the Gateway Year to prepare those students for further studies. It helps them to develop their independent learning skills, and we get them to reflect on the way that they've learned and revised up until that point. We also have a bespoke tutorial system which is designed to support and encourage those students throughout the Gateway Year to make sure that they are well prepared for starting year 1 after the end of successful completion of the Gateway Year.